Welcome to this interactive study session on applied ethics for WJEC A-Level Religious Studies. Today we tackle the contentious issues of abortion and euthanasia, where the core tension lies between the sanctity of life and quality of life principles. You'll learn how to apply natural law, situation ethics, and utilitarianism with the precision examiners expect. Let's begin by mapping the theoretical landscape. Three key theories dominate medical ethics. Natural law, rooted in Aristotelian and Catholic thought, upholds the sanctity of life and uses the doctrine of double effect to justify pain relief that may shorten life. Situation ethics, from Joseph Fletcher, centers on agape, unconditional love, allowing abortion or euthanasia if it produces the most loving outcome. Preference utilitarianism, associated with Peter Singer, values satisfying the preferences of those affected, and questions whether a fetus or PVS patient is a person with preferences. From your study notes, the sanctity of life is the religious foundation opposing abortion and euthanasia, often tied to the belief that humans are made in God's image. In contrast, the quality of life argument, championed by secular thinkers, holds that life's worth depends on its quality. Personhood is a critical tool for analysis. If a fetus or permanently vegetative patient lacks personhood, they may not have a right to life. Remember to use these terms precisely in essays. When analyzing a medical ethics case, follow this process. First, define the dilemma clearly. Then select an ethical theory. For natural law, apply the primary precept of preserving life, but note the doctrine of double effect may allow pain relief that unintentionally shortens life. For situation ethics, ask which action best serves agape. For preference utilitarianism, weigh the preferences of all involved, considering whether the fetus or patient has preferences. Finally, reach a conclusion that is clearly justified by the theory's principles. Let's work through a 6-mark question. The Tony Bland case involved a patient in a persistent vegetative state. From a natural law perspective, the sanctity of life normally forbids ending life, but using the doctrine of double effect, doctors could argue their intention was to withdraw futile treatment, not to kill. Situation ethics would focus on agape. The most loving action might be to allow a dignified death. For top marks, explicitly link each theory to its key principle and show how they lead to different conclusions. Common mistakes include blurring the two life principles. Remember, sanctity of life is absolute and intrinsic, while quality of life is conditional. When writing about natural law, always link sanctity to imago Dei. For situation ethics, say agapeic, not just loving. Also, mention relevant laws like the Abortion Act 1967 or the Mental Capacity Act to demonstrate real-world application. Avoid generalities, be specific. To wrap up, keep the sanctity versus quality of life debate central. Memorize key terms like imago Dei, personhood, and the doctrine of double effect. For each theory, know its core principle, natural law's primary precepts, situation ethics agape, and utilitarianism's preference satisfaction. Practice applying them to cases like abortion and euthanasia, and always link your analysis to the specific wording of the question. Good luck with your revision.